Polsky, and today I'll be presenting on the impact of an emergency physician lead on operational efficiency, a project launched by the University of Calgary in Calgary, Alberta, Canada. Our group has no conflicts of interest or financial support to declare. Emergency department overcrowding is a challenge facing tertiary care centres around the world and becoming an ever-growing issue in the Canadian healthcare system. ED overcrowding results in loss of patient privacy, delays in care, patient morbidity, and mortality. Poor outcomes in specific high-risk patient groups, including EMS patients with prolonged stretcher stays and emergency inpatients, illustrate the necessity for departmental reform. Emergency department overcrowding is most commonly conceptualized through an input, throughput, and output model. With public awareness campaigns aimed at curbing ED input and intensive resource allocation devoted to ED output, a gap exists in the literature exploring strategies to address the flow of the emergency department throughput. In an effort to improve throughput and target specific breakdowns in flow, in 2018 and 2019, Alberta Health Services in the Calgary zone launched a pilot project at the Foothills Medical Centre and Peter Lougheed Hospital known as the Emergency Physician Lead, or EPL. The approval of this project was heavily influenced by growing concerns about EMS park patients, a subset of patients that arrive by EMS and cannot be offloaded from their EMS stretchers due to a lack of space in the emergency department. Within the Alberta model, these patients remain on EMS stretchers until the care of EMS staff is appropriately allocated to the most responsible physician. This has resulted in breakdowns in care and well-documented adverse events for these patients. In general, emergency physician leads were given a mandate to improve departmental flow through resource allocation, navigating complex patient dispositions, and liaising with consulting services. The EPL physicians were specifically instructed to focus their attention on EMS park patients. Although the pilot project outlined a number of potential functions for the EPL, the optimal performance of tasks which resulted in the EPL's impact remained unclear. Our team sought to conduct a review of the EPL project to gain an understanding of how the EPL impacts patient flow and to determine which roles and responsibilities improved emergency department throughput. The primary objective of our study was to look at patient length of stay in the emergency department, with secondary outcomes examining metrics of patient flow through the emergency department by looking at time points such as time to investigations or time to assessments. This study was a retrospective cohort study of patients seen by the EPL between March to June 2019 at the Foothills Medical Centre Emergency Department, examining 1,343 patients. This was compared to a control group of patients seen between March to June 2018, looking at 5,530 patients. Data was obtained from the hospital electronic medical record. A variety of patient demographics and flow metrics, including length of stay, time to first assessment, time to last contact, and time to consult were analyzed. Compared to the control group, the EPL group had a decreased median ED length of stay, 6.3 hours versus 11.3 hours. They also had a decreased length of stay for patients who were above the 90th percentile, which were patients who had the longest boarding time in the emergency department. In addition, there was decreased time to investigations, 0.9 hours versus 1.9 hours in the control group, and decreased time as an emergency inpatient. However, compared to the control group, the EPL group resulted in an increased time to most responsible physician assessment. In conclusion, evaluation of the EPL role demonstrates improvements in several metrics of emergency department flow, particularly length of stay compared to a historical cohort. However, future directions are needed in order to show that EPL may act as an effective strategy to improve emergency department overcrowding. A study design that infers causality would be needed to further validate implementation of this role.